I am Tukai Chakraborty, your clinical nursing guide. Today I'll be talking about narcotic policy as requested by one of my friends. So narcotic medications like fentanyl, morphine, codeine oftenly associated with opioids. These medications are used in critical areas like emergency, ICUs and all. And the medications which induce sleep and euphoria and also reduce the perception of pain and also having the potential for causing addiction and abuse. Okay, so that is why healthcare setup must require a policy, narcotic policy, and that policy implies to all the workers, specifically for nurses, it involving receiving of the medication, then storage of the medication, then administration of the medication and disposal of the medications. Okay, so we'll discuss in each and every processes in details. Okay, so first one is the procurement and the issue of the narcotic medications. The procurement must be done by the pharmacy, and pharmacy persons issue the medications against a valid prescription, and that prescription must be triplicate in form, and which must be signed by a clinician and as well as intensivist. Okay, then the medicine storage of the medication. Okay, so when nurses are receiving the medications, they must store in a double locked chamber or the cabinet or the storage. Okay, and the key of the storage must be always with in nursing in charge or the shift supervisor or team leader. Okay, then record keeping. So register you have to maintain, one register you have to maintain, like in that register you have to mention the name of the medication, dose of the medication, then expiry date of the medication, who is receiving the medication, then the quantity of the medication and signature and all. Okay, then administration of the medication. So before administering the medication, you have to check the prescription. Always that prescription must be signed by a authorized person, and then you have to, before the administration, you have to follow at least five rights of the medication, and you have to cross check with another healthcare person, and then you have to administer the medication and you have to monitor the patient. Okay, then documentation. After giving the medication, you have to mention in the nurse's note and medication chart. Okay, then shift to shift count. Okay, so in every shift you have to count the medication, remaining medication, and any kind of wasted medication or discarded medication, you have to maintain the count. Then disposal of the medication. If there is any unused medication or the wasted medication, how you will be discarding that medication. Okay, for that purpose you have to follow or adhere to the hospital protocol or the policies. Normally, the medication normally discarded under running water and witnessed by two healthcare persons, maybe pharmacist or the doctor. Okay, then you have to document all the processes. Okay, thank you, and do like and share for if you like my videos. Okay.